Welcome back to another exciting episode of We Heart Therapy. You're watching your guide to therapy and coaching. I'm your host, Anabelle Bugatti, and today we're talking about treating teens with mental health and substance abuse problems. Today we have a very special guest. Her name is Sasha DeCania. She's a licensed marriage and family therapist here in Las Vegas, Nevada, and she's the program director at a center here called Destinations to Recovery. She's going to talk to us about treating teens and their specific needs in mental health and substance abuse. Thank you so much for being here with us today.
Thank you for having me. I'm really happy to be here.
Absolutely. So can you talk to our viewers a little bit about the kinds of issues that you see teens struggle with?
Absolutely. So I've worked in the Valley for quite some time, so I was very excited to be invited to be the program director here because I know some of what happens to our teens going to the schools in the Valley that are so huge. One of the biggest things that I've seen is anxiety and depression, right? Most young people who come in to here or came in to see me when I was in outpatient care were struggling with depression, anxiety, poor self-concept, and oftentimes suicidal ideation with or without a plan. And those are the things that I see here in this facility. We do also treat children who are dealing with substance abuse as well. So we do primary mental health and or substance abuse. And the kiddos that come in who have substance abuse issues, once those things start to get cleared up, they tend to have an underlying disorder, anxiety disorder, depression, maybe disordered eating, body dysmorphic disorder. You know, those are some of the things that they're struggling with.
So maybe some of the substance abuse is the way that they go about trying to cope with those underlying issues.
Absolutely. They're using, maladaptive coping skills, and so our goal is to help them have appropriate coping skills. Mm-hmm.
And so when you talk about kids that have substance abuse, I'm sure some of our viewers might be shocked, like how young are we talking about?
12 and 12 and
Wow.
up. I mean, in practice, I've seen kids who are younger who have used. Our center here, we focus on children 13 to 17. Sometimes we'll see kids younger than that if they have a maturity level that would fit with the milieu at our location. Then we certainly bring them into care. If they turn 18 in our program, we're certainly not going to turn them away. But certainly there are kids in our valley who use at a very young age.
Wow.
Absolutely.
So we have children, not only in Las Vegas, but kids all over the United States that struggle with mental health issues. You talk about body image issues, self-esteem issues, depression, anxiety, and then some of them are using substances even from a very early age to try to cope with these things, and that's a very important area that we really need to address for our teens. And
absolutely.
So can you talk to our viewers about the types of programs? How does Destinations Recovery address those issues for teens?
So we have 3 levels of care within our company. This location, which is located in Henderson, Nevada, is one of 6 locations that Destinations has. Destinations, their corporate office is located in Woodland Hills, California. We have 2 residential treatment facilities there. So that's the top level of care that we provide. We have 1 house that is primary mental health, and we have 1 house that is primary substance abuse. And then we have 3 locations in California similar to this one that provide what's called partial hospitalization and then intensive outpatient care. So the Henderson facility provides partial hospitalization and intensive outpatient care.
So when you say partial hospitalization, does that mean that that there's a hospital facility on site where the kids live partially?
Right, I know it's kind of a confusing name, isn't it? What that really means is the type of care that they're receiving. They're in care anywhere from 6 hours or more. They receive psychiatric care, they receive therapy, individual therapy, they receive group therapy, they receive family counseling, which is a requirement of our program, and they also receive education on site. So in the mornings, the kids who are in partial hospitalization come in the house, in our location, around between 8:30 and 8:45, and then we start school at 9 a.m. and that goes to 12. And then at 12 they take a lunch break and then they start their therapeutic services. So partial hospitalization is really an insurance term that refers to that level of care that is sort of a wraparound service. These are for kids who are stable enough to be living at home but are not stable enough to be at school and not stable enough to not have 5-day-a-week treatment.
So partial hospitalization means that they are able to live at home with their parents, but
Yes.
they're not behaviorally or mentally developed enough to be able to participate in public school.
They're not stable enough,
Not stable
right?
enough, right.
Either they're not stable enough with mental health concerns, or they're not stable enough in their sobriety or in their remission from substance use.
Right. So when they come in, you guys actually have teachers on site that sort of homeschool them on site, basically?
Kind of. We have licensed teachers at our facilities, including this one, at all of our facilities, and they help administer either the young people will bring work from their home school if their home school will collaborate with us. Some schools will. We will help them get registered in an online school. We use one particular program called Acellus, and it's nationally and internationally accredited for high school, college, and GED work. So we'll help them with that if that's the right fit. We've had some young people who've been enrolled at different online schools in the Valley, and we'll help administer that program as well. Great. So the licensed teacher helps administer whatever educational intervention they are working with at that time, whether that's sort of a homebound program through their home school or one of the online schools.
Great. So it sounds like the kids, most of them are registered, or you'll help them get registered in some type of online high school or junior high or elementary school, whatever level of school that they need.
Right.
And there's a licensed teacher on site that helps them manage their coursework and get through it. And then in addition to that, they also participate in therapy.
Yes.
And, so what type of other services do you guys have here? I noticed you have a game room.
We do. So we have treatment in the afternoons, either for our partial hospitalization kids or for our intensive outpatient kids. So we have a person who comes in and does art therapy. We have a person who comes in and does drama work. We have a person who comes in and does dance and movement. We have a person who comes in and does yoga. We have a person who comes in to do recovery groups. We have a person who comes in and does some mindfulness groups. We do sort of community-based groups as well, like psychoeducation, and also skills. So, we have some young people who are getting ready, 17, moving into 18, getting ready to, go out into the world. We want to make sure that they know what it means to maybe get a job. We want to make sure they understand what it means and why it's important to at least get their GED. So with one of the young people we had here with us this summer, she turned 18 in our program, and she came through residential treatment, partial, and moving into IOP, intensive outpatient. So we helped her with resumes, job interviews, mock job interviews. So we have kind of a wraparound. We think of it. What is going on with this young person? What do they need? Because it's not just individual one-on-one counseling that most teenagers can really sit through.
Right.
Do you know what I mean? They need that experiential work.
And it sounds like they need a lot of the social skills also, being able to correctly read social cues and social situations to navigate the social world around them.
Absolutely. And they do that with us as providers, but they also do that in the milieu.
Right, in the group therapy and the other children they interact with.
Absolutely.
So this sounds like a very holistic approach. Now I understand that you guys also help with meal planning and intervene on meals to make sure that they're getting proper nutrition. Can you talk about that a little bit?
Absolutely. So for our young people who are here with us all day in partial hospitalization, when they come in the morning, we're like, okay, have you had breakfast? What have you had? If they've eaten, then we're like, okay, do you need anything else before you get started? No? Good, we'll get going. Sometimes they bring their breakfast in and have it here. We want to see what they're eating. So we had a young person who came in and she had her, this is a real example, had 2 packages of Pop-Tarts and a Diet Coke. And we had a discussion like that's really not adequate food, and here's why. We talked about what was in it. We talked about what else she could be eating. And then we actually provided her with something else to eat. And then we had to sit down with her folks and said, hey, this isn't really a healthy meal for this young person to get through the day. And here's what the outcome is when they eat like this, right?
And children and their families need to understand what a huge impact nutrition, especially mass amounts of sugar, can have on their development and their personality.
Absolutely.
Anxiety can be fueled by caffeine and sugar. So
absolutely. And that was what this young person came to us with. And the biggest concern is the parents of this child did not want her on medication, and nor did she want to be on medication. And so one of the things we talked about is we went back and did history, like what has your food been like? What's your sleep been like? What has all this been like? And for some kids medication is necessary, and so we support that. But for some kids, and this kid in particular, it really wasn't.
Right.
The biggest concern for this child was lack of adequate sleep. There had been a lot of school refusals, so there wasn't a schedule. A lot of poor eating, so there was a lot of some physical health concerns.
Yeah.
So we were able to kind of wrap around that.
So you don't necessarily jump to medication in all cases, of course, if it's necessary.
Absolutely.
You'll help with that. But if parents, would like to try a more natural, holistic route, you guys definitely support that, and will provide the education and sort of look at their whole picture to make sure that we're having a completely supportive lifestyle that will help them maintain that.
Absolutely. If it's necessary, that's what's necessary. That's what's medically necessary. That's what we're going to support. And then we're going to tell the parents why we support that.
Right. Well, and overall health is important as well, not just our mental health, but our mental health is also influenced by our sleep patterns, our eating patterns, exercise. So I like how you talk about that you guys had a discussion with the parents, and you mentioned earlier that you require family counseling with all the families that come in. So can you talk to our viewers a little bit about the family counseling that takes place and why it's so important to require that part?
Absolutely. So kids certainly don't live in a vacuum. They live at home with their families. And some kids live between two homes, right? And have, a much broader sense of family. So whoever is family to this child is an important factor in this child's wellness. Educating the parent on what's going on with their child certainly helps them understand their child better. And teen years are difficult anyway, like I'll say, when kids become teenagers, they fire us as parents and we want them to hire us as a consultant. And in this case, kids are learning who they are as a person, so they want to pull away from parents, but that's the time where parents have to have good boundaries and say, yes, this is your privacy, but you also live in this home, so we have to still work together.
Right, there still has to be some boundaries and rules.
Absolutely.
And parents still need to know how to, in a healthy and, good, positive way, be an authority figure over their child.
Absolutely.
And so you guys help parents learn how to better parent their child, and the family is a system. Like you said, children don't live in a vacuum, and a lot of parents, I get the sense, sort of think, well, my child is just sort of this separate individual. What I do doesn't affect them, or what happens between us doesn't affect them. And it's, we all sort of reinforce each other. If our child has these symptoms, we may be doing things as a family, acting in a way that allows these things to continue, or maybe we allow them because we don't stop them, and we just
and we don't realize what we're doing. We had a young person who would have tantrums, throw themselves on the floor and have tantrums, and this was not a small child, this was a teenager. So after a couple of days here, we're like, okay, this isn't going to work. Let's do something different. And we found something different to do when this young person would get so distressed that that's how they would behave. And what we found is there was a lot of secondary gain, right? So when the child would get upset and do this behavior, the parents would give in. So part of our role is to support the parent to understand that behavior was getting this child their way, but their way wasn't helping that child. It wasn't healthy. So part of what we do to help support the family is we do a family contract. And this contract is a negotiation between what we as the therapeutic staff would like to support them in, what the parents feel that they need and want from that child, and what that child feels like they need and want from that parent. So it's a living contract. And our family therapist comes in and works on that. The individual therapist has input. As the program director, I meet with the families as well. Each week we do a team meeting with all our therapeutic staff to talk about what that family needs and how we can support them. So it's not just this child that we're treating out here and treating this depression.
It's the whole family.
It's the family. And you know what? When you can help a family move in that direction, you get so much more change and you get more cooperation from all sides.
So this is a really excellent program. So teens that struggle with mental health and substance abuse issues to the point where they can't function in everyday world in public school, there are options for them. There's treatment centers across the United States, and here in Las Vegas, There's Destinations to Recover. They have additional locations that are based out of California, and it's a very holistic approach to helping those teens learn how to become healthy and independent, working with the family to create a healthy, holistic family unit, creating boundaries, creating healthy parents, healthy children, healthy families, helping children to become stable and independent and recover from substance abuse or severe mental health issues.
Absolutely.
Again, the holistic approach, they offer yoga, they offer drama therapy, individual therapy, group therapy, skills training. They help monitor their food, check into their sleep activities. Very holistic, you know, doing the family contract and family counseling together so that we can make sure that all parts are supporting each other to grow in a healthy way. So if you're in another part of the country that maybe doesn't have a Destinations to Recovery, I would suggest that perhaps you Google mental health centers or substance abuse centers for teens and children. There's some of them out there. But if somebody is here or in Southern California and they'd like to come, if they like to look into the services that Destinations to Recover offers, how can they find them?
If you Google us and you put Destinations to Recover, you will find our website. We have an 800 number. Our admissions team, and they are licensed therapists, our admissions team, they will talk to you on the phone, help direct you to the right level of care. There's always someone available 24 hours a day.
And what is that website?
Destinationstorecover.com.
Destinationstorecovery.com. And do you know the 800 number?
You know what? I should know the 800 number off the top of my head, and I do not indeed.
We'll get that number and we'll put that in the link to the description of this video. And you guys do take insurance, right?
We do take insurance, and if we are not contracted with your insurance, we've had a lot of success in reaching out to these insurances and say, this is what we provide, here's what's going on with this kiddo. They've been in the hospital several times, or they've been in all these different levels of care, or maybe they haven't been in any significant level of care, and here's what we want to provide. And we've had a lot of success making that happen.
Excellent. So this is an amazing resource that's available to children and families throughout the Valley of Las Vegas, Southern California, and there's other centers across the United States if you want to do a Google search. Otherwise, destinationstorecovery.com. Check them out on the web. Maybe their resources are right for you and your family. Give them a call. They have a great team here that's going to help you get where you need to go. You guys can also provide referrals if they don't happen to meet.
You know, if for whatever reason they're not a good fit for what we have, or if we aren't able to come to terms with insurance, if that's necessary or what have you, we always give referrals. We don't turn people away. I'll get calls for adults who are looking for services, and we help them find services too. So, you know, we realize we are in a caring profession. So when people call, we're not like, oh okay. That's not how it works. That's not how it works.
Excellent, excellent. So this is an amazing resource. Make sure you check them out on the web. Thank you again so much for joining us today and talking about this special topic. Thanks again to our viewers for tuning in. Check us out on the web, www.wehearttherapy.com. If you like what you see here today, please subscribe to the channel. And if you like the episodes, more on the way, so sit tight and stay tuned.